Nishant Kumar. I am an ENT surgeon, ENT head and neck surgeon. I am attached with the Mission Hospital Durgapur since last 5 years. And my area of interest is basically all the chronic suppurative otitis media, ear cases, and nose endoscopic sinus surgery, and in throat and oral cavity like tonsil infections, tonsillar surgeries, and submandibular gland, head and neck infections, and head and neck tumors. These are my area of interest. Lot of oral carcinoma, laryngeal cancers, vocal cord cancer. These are very common in this area because of addiction to this smoking, alcohol, pan, tobacco. These things leads to these problems like vocal cord carcinoma, oral cavity cancers, and tongue cancer. These are very common in this area, and we see a lot of patients like that. So in these patients, first we have to see the patient, localize the disease. We have to investigate and do confirmation by doing a biopsy, and then we have to proceed with the definitive treatment like surgery followed by radiotherapy, chemotherapy. Yes, lot of patients come with this problem of nasal bleed or epistaxis. This happens because of one of the most common reason is hypertension. The hypertension emergency, urgency, so there is a bleeding from the nose. So in these cases, first we have to control the blood pressure and control the bleeding. So for controlling bleeding, we have to give a nasal pack, and side by side we have to control the blood pressure also of the patient. And later on we can go for nasal endoscopy and identify the site of bleeder and control that bleeding. Very commonly we are doing endoscopic nasal surgery for sinusitis problem, for deviated nasal septum, for nasal mask, nasal polyp. We are doing this surgery. Prevention part is that people should avoid having all these smoking habits and all those gutka, pan, tambaku. This should be reduced, and as soon as they find any difficulty like hoarseness of voice, change in voice, or any ulcerative lesion in the oral cavity, any swelling in the head and neck area or on the face, they should immediately go and see the ENT surgeon so that we can early diagnose and we can treat the condition completely. My advice to the people in and around Durgapur is that Durgapur is it's an industrial area and lot of pollution is there, and because of this lot of sinusitis problem and ear discharge problem, hearing loss, these things occur. So my advice is that they should come to the hospital as early as possible. As soon as the symptom starts, they should come and see the ENT surgeon so that the problem does not aggravate and it can be controlled in an early manner.